Hi, this is Dr. Kim. Today I'd like to talk to you about 7 professional remedies for the back of your heel pain. None of us really like to go see a doctor, but if you do need to go, you want to prepare yourself as to what's coming. So you know exactly what your doctor will be telling you to do, so you prepare yourself. So here we go. So first is your doctor will prescribe a night splint. This is a splint that you can put on at nighttime. A lot of people ask me if they need to sleep with this on, and I tried it myself. It's very difficult to sleep with this thing. I couldn't sleep at all, so I don't recommend something that I could not do myself, so I don't recommend you sleep with it on. If you could, that'd be great, but if not, just use it for about 30 minutes before you go to sleep. Just lay back on your couch, put it on it, have the knees straight, and then put your heel right on the back at the bottom of the heel, and then stretch this. Start slow though. Don't crank it all the way to hurt this, but start slow, and then as you get used to it, do a little bit more every day, so this can go all the way up to about 10 degrees, okay? Then you're going to feel really good stretch, and you're going to feel wonderful in the morning especially. And the next thing I recommend for my patient is physical therapy. Well, physical therapy can do a lot. First you have to strengthen and stretch. We need to not only stretch the back of the heel and the bottom of the heel, which is another important thing you need to do at the same time, but you also need to strengthen. So your therapist will give you a lot of different exercises, whether picking up towels or picking up marbles, to strengthen the muscles at the bottom, and then also the calf area. So strengthening is very important as well as the stretching. So I'd like you to go see a therapist, and then they will see you maybe a couple times a week or so. And you need about 6 to 8 weeks to really improve this condition while all the other treatments going at the same time to improve the efficiency and effectiveness of the treatment. Next one will be custom orthotics. This is what I use to custom make. We take a mold of your feet in what we call the optimal position of the foot. Not standing, because standing would recreate your problem. So we have you sitting, and then we have a special way to balance your foot perfectly to capture the most optimal position of your foot with this casting technique. And then we send this cast to a laboratory where they fabricate your device according to your shoes you wear and the flexibility of your foot type and all the other things that I find out about your feet. I make sure that I put that into the equation to make the perfect or the best orthotic devices possible. So custom orthotic is a very important part of what I do as a foot doctor. So this is what I highly recommend you get. Also, sometimes I use prescription medications to really improve your condition. A lot of non-steroidal anti-inflammatory medication to really quickly get the inflammation out of this area, so that you may have to go back to work or do other things while you're getting the treatment. So this is kind of an emergency thing. I try not to use this too much, but sometimes I use that to get a quick relief of this problem as well. These days, they came up with this topical anti-inflammatory cream that is very effective, and obviously you don't ingest it, so it doesn't go through your system. So it's very effective, yet it doesn't really harm you as much. So this is what I usually tend to use these days a lot more. So this is readily available. I write a prescription, they even deliver to you, or you can go pick them up at the pharmacy at the same time. Next treatment is called the shock wave or radio frequency treatment. I don't use this procedure anymore because it is not covered by insurance anymore, but it's still available. I just wanted to share with you as well. It's quite effective to decrease inflammation, literally break down the scar tissue at the bottom or the back of the heel. Use this machine. As I said, unfortunately it's not covered by insurance anymore, but it is available, and there are other doctors who will be able to perform this procedure for you as well. Another procedure that I've been using for almost 10 years is called the plasma-rich platelet. When Kobe Bryant from Lakers got his tendon Achilles tendon ruptured, he went to Germany to get this injection. And this is what I've been doing over 10 years now to really decrease inflammation and scar tissue of this area and help regenerate the cells in the back of the tendon area. Well, the way we do it is we take about 30 cc of blood from you, and then we put it in the centrifuge and isolate, we call them platelet. Platelet is a coagulation factor. However, it also has a lot of healing factors in them. When we concentrate them and inject into the area of the back of the heel, it miraculously improves the condition very, very well. So those are the professional remedies that your foot doctors may try, so you'll be aware of what's happening to you as well. On the next and final video, I'd like to talk to you about my herbal injections that help literally thousands of my patients from back of the heel pain. We'll see you on the next video. If you enjoyed this video, please make comments below or ask questions so I can answer them accordingly.